The 2012 election is behind us. With President Obama's election to a second term, the Affordable Care Act is here to stay. That's not to say there aren't many items that still must be defined in the far-reaching health reform legislation. The federal government still must provide guidance on many pieces of this complex legislation that will be rolled out in the coming years. But first things first, there are key components in the health care reform legislation that become effective in 2013 and 2014. Dealers must begin planning now and should consult with their health benefits providers, health insurance broker, human resources, and tax professionals to make sure all relevant components are in place and they are compliant with the law's requirements going forward.
The Affordable Care Act was passed in 2010, and various pieces of this complex legislation have already gone into effect, but the heavy lifting will really come to the forefront in the next few years. One of the existing and ongoing concerns for any dealer with more than 250 employees receiving W-2 forms for 2012 is the requirement to report the aggregate cost of the employer-sponsored group health plan on all 2012 W-2 forms and beyond. Dealers who provide health insurance should also be aware that employers are now required to provide a Summary of Benefits and Coverages, or SBC, during the first open enrollment period on or after September 23, 2012. In addition, the SBC template has been standardized so the individuals can now more easily compare coverage offered by their employer's plan with coverage provided by their spouse's employer. In 2013, patient-centered outcome research fees, or PCOR fees, will be another concern for all employers who provide group health plans. Looking forward to 2014, issues such as insurer fees, transitional reinsurance tax, and the pay-or-play employer mandate for companies that employ 50 or more full-time equivalent employees becomes a priority, not to mention the state exchanges and wellness program rules. And even further down the line in 2018, insurers and employers who offer group health plans will be liable for a 40% excise tax on so-called Cadillac health plans. The tax will be on the value of high-end plans above certain thresholds established in the Affordable Care Act. There are as many questions as answers with regard to the Affordable Care Act and how it will be fully implemented in the next few years. The legislation may be tweaked to address unintended difficulties during the implementation, which means employer requirements may continue to be a moving target. My best advice for employers is to stay informed, communicate regularly with your health plan provider, health insurance broker, human resource and tax professionals to ensure you're compliant with the law.
NJ Carr has relationships with various partners, including corporate Synergies and Fotek Business Solutions, both of whom can help dealers buy the most cost-efficient plans for their employees. They can also assist members with any compliance issues related to the ongoing implementation of the Affordable Care Act provisions. NJ Carr will be hosting a webinar presented by Ben Lupin, Senior Vice President of Compliance at Corporate Synergies, on Wednesday, January 23rd, to go over the most pressing Affordable Care Act issues facing dealers in the near term and take a look at what's coming down the road. We encourage all dealers to participate in this valuable training. Whether you love, hate, or are indifferent toward the healthcare reform law, if you have 50 or more employees, you must be compliant with the law or face sizable fines. It's time to educate yourself about these requirements. NJ Carr thought you should know.